The Ohio Hospital Association has a very powerful lobby, says the Toledo Blade. Our experienced advocates give member hospitals a powerful, united voice in the legislative and public policy arenas. OHA has recorded 4 consecutive state budget wins for our members. We achieved these wins because of our focus. In 2012, we strategically aligned OHA around 3 big rocks: advocacy, economic sustainability, and patient safety and quality. OHA is the united voice for Ohio hospitals and health systems. More than 600,000 Ohioans have healthcare coverage because we advocated for Ohio Medicaid reform in 2013. Expanded Medicare eligibility has now been renewed in 3 consecutive budget cycles. $1 billion in Medicaid cuts have been avoided for our members. Unworkable price transparency legislation was defeated at the State House and in court. Non-contracting provisions were removed from the state budget. These would have reduced payments to hospitals that do not contract with all available Medicaid managed care plans. In addition to biennial state budgets, we pushed for telehealth coverage parity. We worked hard to stave off staffing ratios included in the maternity licensure rules. We advocated for the prior authorization bill, which requires commercial payers to provide timely determinations of coverage and a full year of prescription authorizations. And we raised $1.45 million in PAC and special events funds to support lawmakers and statewide candidates who support the hospital community. We convened in critical conversations for our members to meet with federal and state leadership. We conducted statewide opinion polling and launched a statewide value proposition ad campaign to support awareness of our members' work in the community. In Washington, we successfully lobbied alongside the American Hospital Association and other state hospital associations, securing legislation to extend the Medicaid Children's Health Insurance Program, delay cuts to the Medicaid DISH program, preserving our members' reimbursement. We defeated unworkable franchise fee changes in 2015. OHA developed a franchise fee model amended in 2019 to a sustainable level. $4.9 billion in HCAP funds were secured and distributed to hospitals. $4 billion in UPL payments were secured and processed for hospitals. $1.3 billion in Medicaid managed care incentives were secured and distributed to hospitals. We launched statewide quality initiatives launched to attack Ohio's most critical health challenges: infant mortality, sepsis, and opioids. Based on the recommendations of the member-driven Clinical Advisory Committee we launched in 2013. An estimated 3,963 lives were saved through statewide sepsis initiative in 2015 through 2018. $27 million in federal funding was secured to support quality initiatives. More than $1 million in foundation grants were secured to support physician and staff training, including significant focus on opioid prescribing and physician burnout. OHA delivers a robust return on investment for our members. Our members also benefit from OHA's service to reduce operating costs, workforce solutions, workers' compensation and unemployment compensation programs, and the national award-winning Energy Procurement and Sustainability Program. For every $1 invested in dues, we've been able to increase the return on investment for OHA members. For this most recent state budget, we achieved all 4 member-identified priorities: maintaining Medicaid coverage, reforming the hospital franchise fee methodology, enhancing Medicaid managed care accountability, maintaining Medicaid reimbursement rates, and the governor's 25 line-item vetoes, including a price transparency proposal, surprising billing language, and Medicaid managed care provisions that would have been extremely problematic and disruptive to Ohio's healthcare system. We celebrate our wins on behalf of our members. Onward to the next challenge as the united voice of Ohio's hospital community.